Can everybody see that? Panel management in the MOA, excellent. So this is, again, looking at your MOA and how can your MOA help you do some of the panel management tasks. So the most obvious place that the MOA can be involved in is looking at your active inactive patients. If you have an MOA who's been in with your clinic for a while and knows the patients well, they can do a lot of this work, this legwork for you and go through patients and decide. You make the parameters. That's something I actually forgot to mention in my presentation. The parameters for making a patient inactive is entirely up to your practice and your demographic. So you know your patients well. I would say that the average is 5 years, but some physicians go less than that and some physicians do more than that. It's entirely up to you. And then John mentioned in the chat, but if it's also important to recognize that if a family member, so say the older child or college age kid of your regular family patients is away, that's not a reason to make them inactive because you know the family's still coming. So you would leave those ones active instead of making them inactive. When you are doing bulk functions, occasionally mistakes do happen and you do make people inactive. And just as a reminder that by making them inactive, you can't delete a record out of the EMR, you're just making them inactive. They show up again, you reactivate them, all the information is still there. So just as a note for that. So back onto the MOAs. So the MOA can help you do your panel management by looking at things demographics. Are the demographics complete? So they can help you with the cleanup of that, but they are also really instrumental in keeping this information up to date. When you get chart transfer requests, that are they, after they've sent the charts out, do they make the patients inactive? That sort of thing. On the demographic, making sure that the names match the care cards. And this is actually important for other functions in OSCAR, for example, looking at your labs. If the names don't match, then you have that annoying yellow band that you have to resolve. So if you fix those, then it works. It also helps for your rejections that you get those PWEs because the name doesn't match. And every time you bill that patient, you're going to get that PWE until you fix up the name. So make sure the names match on the care card, that they've got the correct birth date, PHN, and gender, full contact information, and especially now, which is including email addresses. And so to just sort of say, are you collecting email addresses, and maybe even making that a little bit of a project to have that as an active thing, have a couple of signs up at the office, have your MOA double check with people that they're doing that. One of the other things too, if you're collecting emails, if you're going to do any emailing to patients, you need to make sure that they have a consent for electronic communication on file. So make sure that that has been filled out. Again, your PSP coaches can help you. Doctors of BC, the Doctors Technology Office has one that you can use to fill out, and it should be one that's a document. The patient signs it with you, they keep a copy, and you file a copy in the chart. The MOA can also be really helpful in making sure that next of kin is listed in the e-chart. So on the demographic, you have an option if the next of kin is also a patient in your practice, you can just do the add relation tab in the main demographic, but you can also put chart notes in if they are not patients. You can have names and phone numbers for those. The MOA can take notes depending on timing and availability. They, note if patients are smokers or not, intake history form, update medication list. Again, that would depend on what tasks you have set your MOA to do and what they are able to do, both with the other tasks they have to keep on top of and their technical ability. So some of the other things that the MOAs can do, and especially once your data is clean, is helping you pull registries. So if you're doing planning for your practice, so flu season is coming up and you want to make sure that certain groups of your patients are called in for that, they can pull registries for you. They can assist you with your QI projects that you're doing by pulling different demographics. You want to make sure that that all of your hypertensive patients that have had their blood pressure done within the last 6 months. So your MOA can pull a list of them and take a look at who needs to come in and call them in for you. They can, help you with your complex care billing. They can even take a look at that billing dashboard, and any of the patients that say they need to be recalled, they can call them in for you without you having to necessarily send a tickler for them. So there's all sorts of things that your MOAs can help you do, and that helps them become a more integral part of your team if they're not already. So, you know, MOAs will say, why? I'm so busy. When am I going to get time to do this? And all that sort of thing. So it is a matter of parceling out that they do have time to do this and that you set aside time for them to do this, not just as an add-on if they're already fully engaged in other things. But the reasons for an MOA to do that, it makes you, as an MOA, it makes you a much more integral part of the team. You know, you are part of the practice. This is your practice as well as the physician's practice. And any physician who's got a good MOA will tell you how vital they are to running your practice smoothly. For yourself, it's your own job satisfaction, you know, that you feel that you're making a difference and making changes in patients' lives, you're making a difference in your physicians' lives, and in how your clinic is run. And when you do these types of tasks, you also learn a lot. And so that gives you opportunities for career growth and and to expand out different tasks that you can do within the clinic and for your physician and staff. So that is what Patti had for her slides. And I would say that, you know, I agree wholeheartedly of that. That MOAs are such an integral part of the team, and the more that you can incorporate them into your practice team, the more valuable they feel, the better job that they will do for you.
That's great, Val. I just want to add a comment there in terms of something that was mentioned in terms of collecting the consent, right? And I just want to share some of the workflow items that people can do for sharing consent. All right, or getting consent. Okay, so I'm just going to take over the screen again for a second. Right. So one of the ways you can collect consent, of course, is to email the consent form to the patient, get them to sign it, and then email it back. Right, and that's what we were doing before. But one of the newer ways that some of our users may or may not be aware of is to do it through pathways. And so if you don't have a pathway sign up, then sign up for that as well. And how do you do that? You click on I'm a new user, okay? And then click contact us, right? And you get, if you send an email to contact us at pathways.bc.ca and say that you want to log in, you can do that. So what you want to do is, if you are a user, you can go to the Pathways Medical Care Directory, okay? You can click on that from the home page, or you can just type pathwaysmedicalcare.ca. And then if you have a site, let's go, there we go. All right, and then search for yourself. And then you'll have a linkage. And so on that site, you can have your online waiting room, ability to book appointments, show what type of appointments are available. But what I wanted to show was you have the ability to email forms directly to your patients from the homepage, or you can ask them to actually go to this page, search like I did, and then click on here. So you have a consent for electronic communications. So they can click on that, and then you can enter a website address, okay, and you can click submit that, okay? But you can click on, so that they can get that actual form, or they can actually just click on the form right there. They can fill in their information right there, what they agree to, read through the blurb, and then do an electronic signature, and then submit it, okay? And once they've submitted it, it will then get emailed automatically to your office email, whatever you have set up for Pathways. So you can do it that way, and that way you don't have to deal with emailing it to them and then them printing it out, signing it, and then scanning it and emailing it back to you. So this way it's all done automatically, then it's emailed into your system. So that's another tool that you can use. Right. And then one other thing in terms of the consent, the Open OSP and has this. I don't think Well has this integrated, but this was a setup where you could show that a patient has actually signed and provided consent, and it's in their demographics. And so if you click on edit, there's an actual section for consent here. And if they, once they have provided consent, you click on that, and you update the records. You'll see that in the demographics. Once you refresh it, it says down here, electronic consented, right? And so that is another way of designating that they have consented, to try to sort out which patients have signed consents and which have not. So that's what I have to help with. Anything else? Anything to add, John? Either John's?
Yeah, I noticed recently in the I'm a well client, I guess. Next to our email field in the demographics, there is a consent to use email for care option. And I thought, yes, and another checkbox to include email in consult letters in case specialists want to contact our patients in that manner. It seems like more and more clinics want to do so.
Yeah, so the thing that you just showed, Herb, actually is built into the trunk. In theory, any OSCAR service provider could turn that on if they chose to. So it's not an add-on, it's actually built right into the trunk.
And following up on that, indeed, there are oodles of features built into OSCAR, but not all of them have been activated. Keep in mind that OSCAR was created originally in Ontario, so there are a lot of differences in how Ontario physicians work, what data they need to collect to get paid, et cetera, et cetera. And that's why we sometimes see some strange items that seem to do nothing when we click on them here in BC.
Yes, John, I would add in too, for any users that are with Well Health and using the OSCAR Pro version, which was developed in Ontario. So they're currently working on updating the PSP panel management piece for that. Hopefully that should be out and updated by the end of this month, if not by the end shortly after. So that, just keep that in mind if you are on the Pro version.
And I'll just add into that the dashboard itself for finding patients and list still works. What doesn't seem to work is the bulk functions. So you can't bulk inactivate, you can't exclude from registry, all of those functions, but it does work to show you the patients. And if you go through them, if you wanted to clean up some of your disease registries, you just have to do it when you're looking at the chart and reviewing the chart. You have to add it in the chart as opposed to doing a bulk function for it. So, but hopefully they will have that fixed, as Ken said, very shortly.